Hello, and I'm Adam Saltz. Today we're going to review New York University's Aesthetic Analysis form. With Will, nice to meet you.
How's it going?
So Will, tell me what do you want to have fixed?
My smile.
And what's wrong?
I just look like it.
And by little, what do you mean? Because I see a lot of problems.
I want to make my smile straighter, more pretty looking.
Now, I can't make an ugly person beautiful, but what I can do is try.
Okay, I'm a cheerleader now. U-G-L-Y, you ain't got no alibi, you ugly. Hey, hey, you ugly. U-G-L-Y, you ain't got no alibi, you ugly. Hey.
So tell me about your smile. What do you like? What do you not like?
I think my teeth are crooked, but I think you're the specialist. I want you to fix my teeth.
Okay, so I'm not a specialist, but I'm going to try to do my best. Now, if there's one thing in particular, let's say I had a magic wand, what would you want me to fix?
Say make them straighter, get the tips of the teeth straight,
Okay.
they all line up, make me look pretty again.
The first thing that we're going to do today is facial analysis. Essentially, we're going to take Will's face and divide it into 3 different planes, both horizontally and vertically.
We're gonna cut my face.
So to conclude the facial analysis, it's important to get an idea of the side profile of your patient. So we're going to look at 2 different planes, the E plane and the nasolabial plane. For the E plane, we're going to position the ruler or any straight-lined object that you have from the nose going down to the chin. And we're going to measure the angle from the nasolabial line, so moving outward from the face. And we see that generally, and at least in Will's case, we have a convex profile. The next part of the smile evaluation form is the occlusal analysis. So we're trying to look for clues within his mouth to give us an indication of whether he sucks his thumb, or he's a grinder, or he could be a mouth breather or clencher. So using the clues that we see from his occlusal profile, open, awesome. We see here, lights, camera, action, open.
Wash your hands.
I don't see any wear facets on his posterior teeth or his anterior teeth. So that's a good indication that he's not too much a grinder. And Will, do you grind?
No.
Great. See? Does his facial midline match his dental midline? So smile for us. We're going to see that if you look down his facial profile, that it does match for the most part his dental midline. We see a little discrepancy from the tip of the nose, I'd say a millimeter or so to the left. Cameraman, would you agree? We agree. Cameraman agrees. So it's important to get an idea when you're building these aesthetic cases, not to look with tunnel vision, but to look from a greater scale. So we're also looking for overbite and overjet. Overbite being with Will, looks to be within normal limits. From a side profile that he has a few millimeters overjet, which is again within normal limits. In terms of spatial crowding, open for us one more time, please. We really don't see too much crowding. We see a little crowding in the mandibular anterior teeth. We also see some crowding, not so much, a little overlap between numbers 8 and 9. So we're going to see if Will can properly make the following sounds: the M sound, the E sound, the F and V, and also the S, to see if they're within normal limits or there's a sound deficiency. So Will, can you do the M sound for us?
Monkey.
E.
E.
F and V.
F. D.
S sound.
Sally sells seashells by the seashore. Seashore. Shore. Sea. Sandy seas.
Great, and could you practice swallowing for us?
I'm about to swallow.
We're we're going to go through and evaluate his facial contour, golden proportion, incisal embrasures, axial inclination, tooth spacing, gingival zenith, gingival papilla, and gingival biotype on both arches. We're going to be looking at tooth, lower lip position, lip line, midline being the relationship of the central incisors to the philtrum, the incisal edge, any canting to the left or the right, tooth exposure during physiologic rest position, smile line, number of teeth exposed in a full smile, and the buccal border.
You're beautiful. You're beautiful. You're beautiful. It's true. I saw your face in a crowd.